Hello, I'm back. This is Rockson Liu, dedicated hernia surgeon in Emeryville, California. Um, I thought I was going to move on, but I guess I have more to say about how to find a surgeon. Um, one thing that can help you also kind of get some insight into the surgeon is do they tackle complex hernias minimally invasively? Okay. So, there are a lot of complex hernia surgeons. There are lots of centers for hernia surgery, complex abdominal wall hernia reconstruction centers, ab wall centers, et cetera, across the country. Um, but I can tell you that most hernias, even the complex recurrent ones, do not require open surgery. Okay. Now, the ones that do require open surgery are the ones where what we call loss of domain, where the defect is really big and most of the internal organs are sitting in the hernia sac outside of the abdominal wall. Those are actually pretty rare, and those require true open abdominal wall reconstruction. Okay. Most complex hernias, even the ones that are multiply recurrent, they've had, three or four hernia surgeries and the hernia is still back, or there's mesh in the space that the hernia surgeon needs to go back into, can be done robotically. Okay. And there are very few surgeons in this country, I think, that can tackle these complex hernias robotically. And so you really want to find out from your hernia surgeon, how do they do complex hernias? Even if your hernia is not complex, how do they do it? Do they do it robotically? Do they do it open? What percentage do they do robotically? What percentage do they convert to open surgery? If they do laparoscopic surgery for these complex hernias, then I would avoid that surgeon, because that surgeon is not good at robotic surgery. Because with these complex hernias, it definitely should be approached robotically. Okay, and the reason I harp on the um, find out about the complex, how they treat complex hernias, is because um, a very good robotic surgeon who can handle complex surgery will see simple hernias as a cakewalk, right? Almost like they can do it in their sleep, right? Simple hernias do not stress me out. Okay, simple inguinal hernias, simple ventral hernias, even this straightforward incisional hernia, it doesn't stress me out. It's easy surgery because I tackle the complex, the most complicated stuff robotically. Um, and to be able to tackle the really complicated hernias requires a lot of precision, a lot of experience in dealing with scar, a lot of experience in dealing with intestines intertwined with mesh, right? A lot of experience in dealing with absent tissue layers, okay? A lot of experience in suturing very big defects together that don't want to come together, right? When you have dealt with a lot of situations like that, the straightforward anatomy, the straightforward hernia becomes very easy, right? And when it's easy, you do a better job because it's easy to stay in the right plane. It's easy to not have any bleeding. It's easy to be very gentle with the tissue. So then you're going to get better results if the surgeon is very technically skilled, right? So I truly believe that a surgeon that does a lot of complex hernias with the robot will handle straightforward issues very much better. Now, that's not to say that there are surgeons out there who aren't really good at simple robotic hernia surgery but don't do complex hernias, right? There are a few surgeons that I know of that have done thousands of robotic hernia surgeries, right? They are very good at the straightforward stuff, but they will tell you very honestly that they're not very good at the complex stuff. And that's okay, right? But there are very few surgeons because, again, robotic surgery has been around since 2001, I believe, is when it was FDA approved. But most hospitals didn't get the robot till 2003. But general surgeons didn't really fully embrace robotic surgery until close to 2020, right? And robotic hernia surgery, was, just recently fully embraced by most surgeons across the United States. So it's a relatively new platform for a lot of hernia surgeons, right? And so there are very few surgeons who have done thousands of robotic hernia surgery. So very few surgeons can do this simple, straightforward stuff really well. But the surgeons who dedicate their lives to hernia surgery and tackle both complex and simple surgery, those are the ones that will be able to treat all hernias with finesse and precision and gentleness, so that there's quicker recovery and less trauma to the tissue. And also, like I mentioned in one of my previous videos, what can seem straightforward can sometimes turn into, kind of an unusual situation. And so the surgeon who has dealt with the most complex stuff and has seen everything, they probably will have seen your situation, your unusual situation, in the past, right? Like one thing that I frequently encounter with inguinal hernias is these interstitial hernias, these hernias that are kind of off to the side of the internal ring that, it's kind of different. So how do you fix it? Or somebody who has an obturator hernia, right? You go in thinking you're fixing an inguinal hernia and all of a sudden you find an obturator hernia. What do you do, right? So, a surgeon that's skilled at complex hernias can deal with that. Another situation is somebody who has had kind of lower abdominal surgery. Maybe you've had an open appendectomy. Maybe you've had a colon cancer resection. Maybe you've had a prostatectomy or a hysterectomy. Whenever there's previous surgery, there could be unusual scarring. There could be loss of peritoneum or other tissue. And the surgeon has to get creative, or they have to be very careful in dissecting through those layers. And you don't want a surgeon that is not very facile with a robot or not very experienced with robotic hernia surgery. So I'm keeping this one short, but mainly I want to kind of just talk about how a true hernia specialist who does not just a lot of hernia surgery, but who is a truly dedicated robotic complex hernia surgeon, how they can have better outcomes with simple hernias. Okay? All right. I'm keeping this one short. I'll see you again in the next video.